Oh, here we go. Check 1, 2. 1, 2, check.
Got it. Hey, boss man. Woo. Got it.
Oh, here we go. Check 1, 2. 1, 2, check. Check 1, 2. 1, 2, check.
Test, 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 test.
Do I need it?
Yeah, because the audio is not going to come through without the mic.
All right.
So.
Okay. Okay. Hi, everybody. I don't know if you know me. My name's Heather James. I'm the new clinical manager. I've kind of seen all of your faces. We'll learn all of your names. But I understand you're going to be starting to do some medication administration on the weekends. So I gave you lots of information in the packet. Not to scare you, not to make you nervous, not to say you're responsible for everything in here, but just to give you some idea of what it means to give a medication, what to look for, if there's a reaction to a medication. My understanding is the medications will already be prepared, so all you will have to do is really hand them out to someone. But you do need to be aware anytime you give anyone a medication, there's a potential for a reaction. There's a potential for side effects, which is why I included some of this information. Most of the guys will have been on this medication for a while, so you will not see many side effects, but you can. Okay? Anytime you would give a medication and you would have someone who you think is having an allergic reaction, they're having swelling of the face, they're having hives, they're feeling lightheaded, that is a sign that it could be an anaphylactic reaction. So that is something you want to address right away. You would want to actually call 911 if it's a severe reaction. That can happen the first day you have a medication. That can happen the 9th month you're on a medication. So you do want to be aware of that. Even though you're just handing out the medication, you want to keep an eye on that person the whole time that you're giving that medication, making sure that they're not having any reactions to it. There are prescription medications. You're also handing out over-the-counter medications, things like ibuprofen, Tylenol, things that are just given as they're needed. Those as well may not be given each time you're handing out the meds. They may be coming and asking for that at a certain time. So you would certainly want to know why they're asking you for it, maybe write down the reason why they're having knee pain, back pain, aches, whatever. I understand from Ashley that most of the guys that have asthma, that have inhalers, they're carrying their inhalers with them. So that is not something you have to worry about, but if they would probably be come to you because you're handing out the medication. So When you're handing out the medication, you're really looked to as the medical person, even though you're not trained medical people. Odds are at some point someone may come to you with a problem, with an empty inhaler, whatever it might be. So Ashley has told me she's been very accommodating about making sure that those things are taken care of, but just so you have some idea, you will be representative of that medical person just by rights of handing out the medications. I also included some information on insulin injection sites. Again, you will not be giving the actual insulin shots, but it's good to know that when you're watching someone, are they giving it in the right spot? There's some unusual spots like in the belly, on the thighs that you may not be aware of, that you may think they're not doing it right. But those are all acceptable sites, and they shouldn't be giving it in the same site time and time again, because it can leave some scarring. It affects the absorption of the insulin. My understanding from Ashley is everybody that has the insulin is using the insulin pen, which is why I included that information as well. Again, you will not be physically doing anything with the pen other than handing it over to the patient, along with the needle, which comes separate, which is attached to the pen. It comes prepackaged. Your guys should be skilled and understand how to use that. You're just observing to make sure that they're doing it properly. And then you do need to make sure that the needle is removed from the pen and disposed of in the sharps container. There are different kinds of pens. They look different colors. They have different types of insulin in them. They're all used exactly the same way. It just has a dial at the top that they dialed in units, and then they just give the injection. There are also, some of the guys may tell you they're on a sliding scale for their insulin, which just means they have a base number of units that they give. They test their blood sugar. If their blood sugar is a certain level, they may have to give themselves some extra. Again, they're coming down to you understanding what that means, how to do that. If you ever have anybody that is unsure, needs diabetic teaching, Ashley can let me know. I can certainly help her out with that as well. But most of the guys are going to be skilled in that. They're going to know how to check their blood sugars as well, and medicate themselves appropriately. They should be getting their insulin prior to eating, if at all possible. I know it's tough for you guys with the timing, but that is ideal if they can check their blood sugars and get their insulin prior to going down to meals as opposed to afterwards. It gives them better control of their insulin. As for med diversion, that's something we battle with at detox and short term, something you may battle with in long term as well. I understand from Ashley that most of the medications are being crushed now and given in an applesauce or some form of food to be able to swallow, which greatly diminishes the potential for med diversion. But there are several very creative ways that we have run into that guys are cheeking the meds. They can be very good at it. We have got flashlights out and tongue depressors to really look and see where the medications are. So whatever you're giving, even if it's a Tylenol, too much Tylenol can be deadly. If someone's they're keeping it, they're cheeking it, they have 6 or 7 Tylenols that they're taking, that can put them into liver failure. So no matter what, you should ask them to open up, check their mouths, stick their tongue out, watch when they're swallowing that they are actually swallowing. Even with the crushed pills, make sure they're actually swallowing the pills completely. You can have them swallow water afterwards, after they've already taken the medication. That helps as well. If you have someone that you're really suspicious of, you can have them take their fingers and pull their cheeks to really get a good look at the mouth. Another one, which was a surprise to me, actually, I had one young man explain to me how he did this. He actually would regurgitate the pill. So he would swallow it, it would be clean, his mouth would look clean, he would leave, and he'd cough it up until he could get that, and then he would take it. So we've recommended a full cup of water to make sure that it's going down completely, and really watch that they're swallowing. It sounds like something basic, it sounds like something simple, but when you're trying to give meds to 50, 60 guys, they're in line, you want to hurry, everybody wants to get to mealtime or get to where they need to be going. So it's easy to think, okay, one down, let's do the next one. But you really want to make sure that you're observing every single man that's getting the medications to make sure that they are swallowing completely, that you're not having a problem with diversion and finding pills in rooms or whatever. Another one that we run into a lot is I call it the distraction pocket method. You will have someone getting their meds, someone behind them who decides to hold a conversation with the nurses, talking with the other guys, making a lot of noise, so you're not watching, and that particular gentleman will pull the pill and put it in his pocket. So what we try and do is keep hands away from the mouth whenever you're administering medications, other than holding the cup and holding I'm assuming you're giving it a spoon with the applesauce or whatnot, but all they should be holding is what they absolutely need to have in their hands. And try to limit the distractions. I know it's easier for us because we have more staff. I understand it's difficult with fewer staff, but even if you have to quiet people down or take people more one at a time, have them stand back, whatever that looks like for you. Don't let yourself get distracted or in a conversation while you're handing out medications, because it is a serious thing. And some of these men are on antidepressants, they're on some mood stabilizers, which I did include some of that information in your packet just to make sure you have a basic understanding, because I know you're seeing more and more gentlemen with more and more issues requiring more and more medications and some potent medications. So I wanted to kind of put that in there as just a generalized, some basic side effects, some disorders that you may typically see coming down. It's getting more complicated, and more people are coming to you more and more medicated. And we are working to try and see how we can best help you from a detox short-term perspective on our end, and also to be screening other men coming into the program, because whether we think it's a positive or not, a lot of people are coming on mood stabilizers and antidepressants. Some men are very well stabilized on these medications. They just take their medication as it's prescribed and they have no other behavioral issues and they're doing very well. For others, it may not be as smooth as that. So we do want to make sure that you're giving the medications on time. That's another big problem that can occur. If someone should be having a med 4 times a day, they shouldn't be getting it at, say, 5 and 7. They need to be spaced out properly according to the timing, which, again, I understand Ashley is kind of setting that up for you, so all you really will be responsible for is giving the particular medications that she has laid out for the guys. So you're not going to have to worry about picking all the meds out and what exactly they are and that type of thing. If you have any questions at any point in time, though, there's always someone in the detox nursing office. If you're really concerned or you really have a problem, I've told all the staff, they can answer your question. I can't promise they can come down and help you, but they can at least by phone answer a question that you might have. Okay. Anybody have any questions? I'm kind of interested to what your challenges are in meeting the needs of your patients and how you're handling what issues you're running into, so I can help you with more specifics that you might need. I can put them on for you. Okay. Yeah, I will make sure that all of the information that we're handing out, we will be emailing that, so everyone will be having the same information. Okay. Any questions? No? Oh, okay. Any of the induction centers can ask questions as well through the streaming process, so I'm open for anything that you might have, any challenges that you might face, any things I can help you with, or maybe problems that you have solved in a certain way that I can learn from you as well. It certainly is a give and take, and I've been a nurse for 31 years and I'm still learning almost on a daily basis, and I'm learning a lot from the gentlemen as they come through the programs. So I'm here to learn from you as much as you're here to learn from me. So any kind of issues, questions? Yes? Okay. Okay, the question is, if you have a student who has forgotten his medication, they haven't been prepared for him, okay, and he is in line to get his medications, and how would you handle that? Okay. I really don't have a good answer for that because Ashley is the one who's really coordinating the program. I would have to check with her and find out how to handle that. I know both she and I think Brother Rich have keys to the med cart. I don't know, Joel, maybe you can address that too with who else have access. Yeah, they would, someone would be available to help you with that. My understanding is Ashley's always available. I believe Brother Rich is always available, so they could come in, and that gentleman may just have to wait until someone can come and help you out with that. Okay? Right. If it's around a mealtime, have them go for their meal and then come back. That's always an option. Or just explain to them. You know, if the timing of a medication doesn't have to be exact. So if it's scheduled for 5 o'clock and it doesn't get given until 6 o'clock because there's a problem, that's okay. If they're completely skipping a dose and they're coming to you and saying it's 5 o'clock, well, I didn't come for my noontime dose of medication, you're just going to give the 5 o'clock dose. You're not going to go back and give other medications that he chose not to come for or that he didn't get. Just give the dose that's scheduled for that time frame. Okay, anything else? No questions? Okay. Okay, thank you very much for joining us. Again, I'm available for questions. I'm available by email. If any of the induction centers have a question that they want to email to me, I will get back to you on that as well. Okay?
Thank you, everybody.
Okay.
Thanks, Heather. Appreciate it. Just having you guys as a contact point